This episode of Doc Talk is brought to you by First Bank. We're not just your neighborhood bank, we're your neighbors. Our local team lives up to the name, putting our customers and community first. To experience First Bank difference, stop by any of our 13 Knoxville area locations or visit firstbankonline.com. First Bank, member FDIC.
Hello, my name is Dr. Rob Page, and welcome to Doc Talk. Doc Talk is a podcast that's produced by the Knoxville Academy of Medicine that features its member physicians, giving information to patients that are important either temporally or important in terms of patient decision-making for their continued health care. And I feel delighted to have with me today Dr. Elise Denaney. Dr. Denaney was the former host of Doc Talk, and I managed to wrestle control from her. She begrudgingly gave it up to me. Now she knows that I'm not telling the truth. So she gave it over to me, and I'm so happy to have her back and be able to interview her and talk to her today. Dr. Denaney is an ear, nose, and throat surgeon here in town, and we're here to talk about coronavirus and the flu. Talk about vaccinations, talk about the differences, how to tell the difference between the two, and a variety of topics therein. Welcome.
Awesome.
Welcome back.
Thank you.
Welcome back. You're in the other chair now. So
You upgraded the chairs.
yeah, I know. We went from the easy chairs to the hard chairs.
You got high class.
We went to hard chairs. So what is it? So with coronavirus in full swing in the Knoxville area, and flu season right upon us, what sort of information would you like to give us regarding, first of all, how to tell the difference between the two? How do I have coronavirus? Do I have the flu? Do I need to go get tested for either or for both? What do I need to do as a patient if I come down with symptoms that I think is one or the other?
Okay, good. All right, well, let's start at, so what you will see in the press is this thing called twindemic instead of pandemic. Pandemic was referring just to COVID-19, and now twindemic is referring to the flu virus spreading and simultaneously with COVID. So we're seeing about the third surge of COVID right now, and occurring simultaneously with the flu spread. Flu usually season runs from November to April, and we're going to see it start to spike. Flu is a virus. You know, it's the H1N1 or H2N2, whichever one comes across at this time, but it's a virus. COVID is a virus. What are the symptoms? Well, you know, you've seen already, COVID could be called a bad cold. I haven't had COVID yet. You've had COVID, had a bad cold. You know, the symptoms, and you know, the flu is not so different. People get bad cases of the flu, and then some people get not so bad cases of the flu. So what are the symptoms? Symptoms of flu: runny nose, fever, myalgias, congestion, nasal congestion, not so much shortness of breath, which is one of the COVID hallmark signs. What are the symptoms of COVID? COVID, you can have fever, shortness of breath, not so much myalgia, but that can develop a little bit later. A hallmark that differentiating meaning you can tell the difference between flu and COVID is loss of smell and loss of taste. That's one of the things that seems to be more closely aligned with COVID. Both of them can have diarrhea, so it's kind of hard sometimes to tell the difference. And unfortunately, being in ear, nose, and throat, this is sinus season also, because we have fall allergies setting in, mold allergies, same kind of problems. You have nasal congestion, you have a headache, you have a runny nose, you have a sore throat, and you have a cough. All those symptoms are common in each camp, in sinusitis, in flu, and in COVID. They're all the same. So what do?
Go see you.
One things you can do is call your provider, okay? I know, or I hope I know, my patients pretty well, and I know the pattern, and I know their symptoms, so I know how their body's going to react to certain things. Hopefully everybody listening has a doctor. If they don't, that's okay. We can get you cared for, but you probably will need to get tested, especially if you've been exposed, especially if you want to protect your loved ones who are over the age of 65 from harmful effects of COVID. So getting a test is not difficult. You can get tested at, as everybody knows, you can get tested at CVS. You can get tested at some of the minute clinics, some of the urgent care clinics. You can get tested at UT. You can get tested at all of the hospitals. Easiest way to do it, though, is to call your provider. So let's talk about, since it's really, really hard to tell the difference between the three, best thing to do is prevent it, right?
Right.
Okay, so how do we prevent it? Well, you know, it's really interesting. We are seeing a lower number so far of flu because people are practicing good personal hygiene. That means, you know, coughing into your elbow, washing your hands. Wearing masks actually makes a difference in aerosolization and droplet spread of the virus. So those do mitigate. That means it kind of tamps down the possible risk of transmission of either your flu virus or your coronavirus or even bacteria or viral infections that give you sinusitis. So since you can't tell the difference, practice those good personal hygienes, washing your hands, wearing a mask, social distancing. But then there's something that we do have to fight the flu. That's called a vaccine. Don't have it yet for COVID. That's on the Christmas list.
Yes, exactly. Yeah. I was going to say maybe the Easter list or
maybe the
4th
Easter
of July list.
All right, so what's a vaccine? Everybody by now is, you know, social media is so good in the sense that it gives a lot of information, gives a lot of misinformation, but at the same time, we're smart enough to try to figure out the difference. Okay, so we do have a flu vaccine. Flu vaccine comes out every year, comes out different. We predict, some really, really people much smarter than me, they figure out what flu virus is going to hit North America in the year of 2020. And based on their predictions, they tell the pharmaceutical companies to manufacture flu vaccine so that we will generate antibodies in case that virus comes across our radar. So this year they have a quadvalent, quad meaning 4, valent meaning 4 types of viral particles. They're inactivated, okay? So these are particles, they're not live. These are inactivated particles. There are some that are attenuated, but most of the vaccines that you will see out there are dead particles of the virus. It's safe, and there's 4 different types. They inoculate you with it, and you'll generate antibodies. And it'll, in most cases, you know, we like to see the people that we inoculate or get the vaccine, we like to see that that gives you 75% at least chance of immunization. And it does, for flu it does. I'm not quite sure what's going to happen with COVID.
Now, what type of patient should be getting the flu vaccine? Should older patients mainly, or should it be just anyone should be getting the flu vaccine?
Everyone.
Everyone.
Everyone should get the flu vaccine, especially those who are in situations where they work in close quarters or they live in close quarters. You know, there's certain situations and there's certain jobs where you just can't wear this all the time. And now that the CDC has said that one of the risks of transmission is an accumulative time of 15 minutes or more within 6 feet of each other. We're safe.
We're safe.
I know, I'm not wearing this, but
right,
we're safe.
Right, we're safe.
We passed the test.
Yes.
So let's take, for example, a school teacher. Well, a school teacher, it's really hard. One, it's harder to hear each other with a mask on. Harder to take facial cues, but people, if you do go to school, it's a good idea to get vaccinated. The flu vaccine, you're not going to get the flu from it. When you do get viral particles, you may feel a little bit sick because that's your body generating antibodies. That's a good sign. So I encourage everybody to get a flu vaccine. What's a little bit harder this year, normally the Knox County Health Department gets flu vaccines and they go to the different schools.
Right.
And they go in pods and we immunize all the school children. Well, we can't do that this year for the obvious reason.
Right.
A lot of them are being at home. So Knox County Health Department has a rolling ability, and we're continuing to roll out opportunities in different areas. Just go on their website to find out where you can get a flu vaccine. You can get them at Kroger's, Walgreens, CVS, Publix, pretty much all of them. They should be free. And I would encourage everybody to get a flu vaccine. It will give you immunity, should be through March, April.
Yeah.
Depending on your immune system.
And about the worst thing you would want to happen would be to get both at the same time, because you would have, you have two, because once you get one virus, that makes you slightly more immunosuppressed and then more likely to get a secondary infection.
Correct.
And so you would not want to have both of them at the same time. So at least avoid one.
Correct.
At least avoid one. And one of the things that I always like to clarify when we start talking about using precautions is, why do we wear masks? And you talk about wearing masks in terms of how it can help prevent the virus, but how does that work? And if I wear a mask, will I not get sick? Will it keep me from getting sick if I go into the grocery store? Why do we wear masks, and what type of masks are important to wear?
Okay, it's a great question. So, a lot of different kinds of masks. I'm going to give you first what the CDC says. Whether or not you quarantine, whether or not you isolate, the criteria do not change if you are masked or if you are unmasked. The conditions are the same. What that means is that wearing masks will lessen the possibility of aerosolization and spread. So it's a lot of fun.
Yeah.
Take a mask, light a candle in your house, and blow through it and see the smoke. And you can see the smoke from the candle swirling around your mask. Every mask is different. N95s create a better seal.
Right.
It's really hard on the skin. It's really hard on my airway. These don't give me as much as protection because the air comes around it all the time. And then the material that the mask is made from, it's different for everybody. What I do personally, I wear this one because it's easier to go around with. But when I'm working, I need a little bit more protection. I do an N95. And these things are expensive. So what I do is when I finish wearing it, if in case there's a virus on it, I throw it on the dash of my car and I let my UV light, I let sunlight take care of it.
Absolutely. Absolutely.
So I can get maybe 5 wears out of it. I'm not saying that's scientifically proven, but that's what I do.
Well, I was going to say, and the virus in and of itself, if it's been contaminated, it doesn't live for an incredibly long time on certain, especially dry surfaces, and especially not in a hot car, and especially not in the sunlight in a hot car. So,
Right.
so you're at least doing something to try and mitigate the possibility that you may actually be transmitting something, or that you will actually sterilize the mask.
Right.
So, yeah.
So what the mask will do, to greater and lesser degrees, depending on what kind of mask you choose to wear, is it will reduce the spread of when you talk, when you sing, when you accidentally sneeze, of transmitting it to my good friend here.
Right. So it doesn't necessarily keep you, because the virus particles are so. I mean, we talk about what prevents you from getting it is more likely to, because of your transmission is likely to occur by your hands, and so washing your hands will help keep you from getting it, and wearing a mask will help keep you from giving it.
Yes.
So.
Yes.
I was going to say, it's a clarification, because I think that some people believe that if they're wearing a mask that they're automatically going to be able to, regardless of the type of mask, if they're wearing a cloth mask or a handkerchief or, whatever they might be wearing, is that somehow that's protective. And it really isn't, unless you're wearing, as you mentioned, the N95 mask, which is the one that actually will filter out the viral particles.
Right.
So.
Right.
So we talked about getting immunized. We talked about the differences between the different viruses. What other preventative measures should we take in terms of? You talked about social distancing. We talked about washing hands. We talked about wearing a mask. What other sorts of precautions? We got the holidays coming up. We got Thanksgiving. We got, Christmas. A lot of people communicating together. What other sort of special precautions should we take in a situation like that, especially when we're going to be communicating probably with relatives who are from out of town?
That's a great question. Okay, and there's two parts to it.
Okay.
It's like a teeter-totter. Okay, so sorry, you want to stay safe, and you want to do what is necessary to stay safe, but at the same time, you want mental health. This is holidays. This is when we get together with families. There are so many people who I haven't seen my parents in physically for almost a year, and this is really, really hard. But they're safer with me not there, so we Zoom a lot. Traditionally, you know as well as I do, I see it a lot being in the respiratory field. I dread Thanksgiving through Christmas through Valentine's Day because I call it fondly the great diaspora of germs. Mm-hmm. We go through airports, we're in the airplane, we're on transport buses, we're coughing with each other. It's just a great family sharing of germs. That's without COVID. Yeah. And so now we're going to layer COVID into that present that we give to everybody else. It's even more important at this point in time to wear a mask everywhere that you go. For some people, there's certain degrees of risk of a bad case versus not so bad a case. If you're going to have a gathering of more than 25 people in your Thanksgiving dinner around your table, then do you all wear masks until you eat and then you just gobble down the food and then go watch the ball games? That's kind of ridiculous.
Yeah. Well, that sounds like my family, but that's on a routine basis, so except for the mask part.
So some of you have already been to gatherings over the weddings, funerals, things like that. I think everybody has a certain degree of personal responsibility when they go to these events. So if you want to protect your family, you have to have assessed yourself. You have to ask yourself honestly, could I possibly be transmitting? I've gone to some of my friends' places for a social event and nobody else is wearing a mask, but I am wearing a mask because I'm a healthcare worker. I'm not sure that I could possibly have it because you can have asymptomatic carriage. And I'm going to wear a mask because I love my friends. It makes me the odd man out sometimes, but that's not new for me. Right. So that's what I would recommend over the holiday. Try to distance if you can. Try to wear a mask. Read and know how you can possibly transmit and protect your friends and your loved ones. Bear in mind that if your loved ones are 65 and older, grandma and grandpa, if they're wearing a mask but you're not, just like Dr. Page said, that doesn't give them, that gives them maybe 10% protection, but it's not really enough.
Wow.
Yeah.
So we really need to be cognizant, especially during this holiday season, about how we contact relatives and not necessarily, as you said, I mean, there's an important psychological aspect of this, is that it really is important for us to be with family, and it's been very hard to be without, especially older members of our family, for so long because they've been, in terms of trying to make sure that they don't get sick. But so that we should, as you said, balance it out. Remember that there's a potential that people could get infected, and try to take every precaution we can do.
Okay. So, now I'm going to add something that's a little controversial.
Okay.
So there are studies. I read a lot about it. There are studies. First ones came out of Germany. It has been in the American press now. But if you gargle, okay, if you gargle with certain compounds after possible exposure, it will kill the virus. One of those happens to be, and I'm not branding, but one of those happens to be Listerine mint, okay? So you gargle that, and if you wash your nose out with just saline, so those Neomed rinses that you do to wash your sinuses, that will also give you some protection, just in case you've been exposed.
Wow. So not necessarily espousing this as a way to definitely stop it, but there certainly has been some research done on it.
Right.
So
No trouble. There's no downside to it.
I was going to say, an ounce of prevention worth a pound of cure. Dr. Denany, thank you so much for joining us here today at Doc Talk. Thank you so much for coming back and sharing your information with us. And with that brings this. I forgot to say, Dr. Denany, if you would like to contact Dr. Denany, David's over here like motioning at me that I need to tell people how to contact Dr. Denany. So, Dr. Denany, if we're interested in seeing you as a patient, as an ear, nose, and throat physician, if we have problems with sinuses or other sorts of respiratory issues, how can we contact you?
Call David.
Call David. Call David. So at this point, we're calling David and we're telling David. So we're going to show at the bottom of the screen. Bottom of the screen here, there will be Dr. Denany's office number. There will be Dr. Denany's contact info, her telephone number, and website. Do you have a website they can get additional information on as well? And so you can contact Dr. Denany and see her as a patient. She's a wonderful physician. I've known her for years. So she's just really, really great person. You can see that we certainly enjoy being together. And with that brings this episode of Doc Talk to a close. Doc Talk is a podcast that's produced by the Knoxville Academy of Medicine that features its members giving patients additional information on how to seek therapies or find additional information on how to better their healthcare lives. And with that, thank you so much for joining me. I'm Dr. Rob Page.
This episode of Doc Talk is brought to you by First Bank. We're not just your neighborhood bank, we're your neighbors. Our local team lives up to the name, putting our customers and community first. To experience First Bank difference, stop by any of our 13 Knoxville area locations or visit firstbankonline.com. First Bank, member FDIC.